Welcome to Domain 3, which is all about health records and data content. Okay, so the first thing you need to know are the sections of a health record. And you'll notice here in these first 3 bullets that we have a lot more in the entire patient record than just the physician's documentation and maybe test results. We also have business information and consents and acknowledgments, in addition to the specific healthcare documentation that comes from all of the healthcare professionals caring for this patient. Some key points for auditors to look at and for you to be aware of whenever looking at the quality of a health record are these 3 things. You could abbreviate them as AIR, okay? Accuracy, which has to do with the correctness of the information that's being entered. Because think about the basis for the delivery of all the care is determined by what is entered into the patient's record. If it's not accurate, bad things can happen, including the patient dying. Integrity means that we can trust the information that's in the patient's record, that someone else cannot come in and change it, that it's complete, because completeness, as we've discussed in the first 2 domains, is we have to be able to trust that this is the truth. And then reliability, which means that there's a consistency to the accuracy and what the data is included. And remember, data is not just a character like a code or the age or a test result. It is also the words that are written by the physicians and in the nurse's notes and vital signs, as well as patient contact information, policy number for the third-party payer, etc., etc. So let's break this down and look at specifically what's included in each of these parts of the typical health record. Business details. Now, depending upon what type of facility is, like in an assisted living facility or a skilled nursing facility, or even in a hospital, they may call it a face sheet. In a physician's office, they may call it a registration form. And certainly you all are familiar with new patient registration forms. Oh, the paperwork, okay? So what are we looking at contained in the business details on this form? Patient's name, address, phone number, email address, sex, although I think that's a gender, age, birth date, as in date of birth, race and ethnicity. Why do we need to know race and ethnicity? Because you know that certain ethnic groups are more at risk for certain particular conditions or diseases, which means the health professionals need to know this so they can ensure that they are watching out, doing the test, doing a screening, whatever is necessary. The same thing goes for age and gender, okay? Occupation and employer name. Well, we talked about, in the last domain, we talked about workers' compensation, right? But also you need to know occupation because certain occupations put patients at higher risk of certain conditions, and that's important to know. Spouse's name in case of emergency or contact, and of course, in case of emergency or contact. Okay. All right. In addition, we have to know who is going to pay for the wonderfulness of the services we provide to this patient. And, you know, a lot of people think talking about money when it comes to healthcare is rude. But, you know, you're working hard to get an education so you can move forward and work in healthcare, right? Are you expecting a paycheck? Right. Or, you know, even if you don't think that it's an expectation, but you kind of need a paycheck, right? Because everybody in this world needs a paycheck. You know, I have said Duke Energy, theoretically has said to me, Dr. Safian, you are an educator. You look to make our community better. You volunteer. This is so wonderful. We're so happy to have you in our community. However, if you don't pay your electric bill, we're not giving you any electricity. Well, guess what? Where do you think I'm going to get the money to pay my electric bill? From my paycheck. So, healthcare, even free healthcare, is not free, because there's still equipment to buy and salaries to pay and benefits to pay. And so every time you have somebody who talks to you about free healthcare, and even universal healthcare, by the way, you get into any conversations about universal healthcare, you're going to pay for that universal healthcare. How? Your income taxes will double. It's got to get paid for. So when we get a new patient, and this needs to be updated on a regular basis, we must know specifically who is going to pay for this encounter. If it's an insurance company or the third-party payer, and on occasion you might find it's a parent or a spouse, okay, all right, but if that's the case, we need to know that. We need to know all the information about that individual. If it's an insurance or a third-party reimburser, we have to have that information, including the name of the beneficiary, which might be the spouse, right, or the parent, as well as the policy number and all the other details, and a copy of the insurance card. Okay. Then we need this section for consents and acknowledgments. You already know this, and again, I bet as a patient, you have been through this, right? You have to sign a consent to treat. You have to sign the assignment of benefits so that the third-party payer will reimburse the doctor or the facility directly and not send the money to the beneficiary or the insured. If information needs to be pulled from another provider or another facility, then you need to have a release of information signed, and you certainly need to have the HIPAA Notice of Privacy Practices acknowledgement signed and in that record. That's federal law. Okay, so now we're at the point of information that directly has to do with the patient's health care. Oh, haha. All right. So we have physician documentation, and look at that first bullet. Look at all those initials. All right, well, don't worry. We're going to go over what all of those mean so you can know what they mean too. Encounter notes will include the history. Now, sometimes it's the patient's entire history. Sometimes it's history of present illness. Okay, we'll talk about that more. Documentation of the physical exam. You know, the doctor says, I looked down the throat, I looked in the ear, I took my stethoscope and I listened to the chest and da-da-da-da-da. Heart, lungs, all that good stuff. Okay, allergies, current medications, which should include prescription medications, over-the-counter medications, and herbal remedies. Herbal remedies still mix with other drugs, and bad things can happen. Diagnostic statement and the treatment plan, which is where we're going to get our codes from. Excuse me. Now, the first little set of initials that you saw after history was PFSH, PFSH, which stands for Past, Family, and Social History. This is going to include the past history of the patient's health, including previous surgical procedures, obstetrics if it's a woman only, immunization history, and developmental history, usually only if it's a child. Then you're going to get family history. Your mother and father, are they still alive? Okay, what about siblings? We have learned that this family history is so important that even closed adoptions now release family history records, because we know how important it is to being able to properly care for a patient. And then social history, and this is not like, oh, who have you dated? Okay, this is not gossip time. This is how often do you exercise, what kind of exercise, what kind of diet, alcohol intake, smoking, and drug use and abuse. This is not to be judgmental, and it should not be judgmental. But these pieces of information need to be part and parcel of the evaluation of what's going on with the patient and what needs to be done by the provider next. An H&P is usually used and written by a physician who is responsible for admitting a patient into an acute care facility, also known as a hospital. The H&P must be in the patient's record within 24 hours of admission into the facility or prior to any procedure or surgery performed. Basically, the H&P is the admitting physician's notes on why this admission to the hospital is necessary for this patient. HPI you will see more often in physician's notes from outpatient encounters, like at the doctor's office or even a walk-in clinic or something like that. And this is history of present illness when a patient comes in with a chief complaint. So why are you here today, Mrs. McGillicuddy? Well, I have this cough and congestion and I can't breathe and my nose is stuffy. Okay, well, how long have you felt that way? Is the cough worse when you lie down or when you sit up, before or after eating? Are you coughing up phlegm? What color is the phlegm? Is it from the throat or from the chest? All of that. That's all part and parcel of the history of the present illness. Again, important details to put into the puzzle of determining a diagnosis or what to do next. Progress notes are most often written by specialists who are on an ongoing basis caring for a patient for one specific condition or issue. So the notes are interval notes, which means they only cover the time from the last time this provider and patient were together until this time. This is usually going to focus on a response to a current treatment plan. You will also see progress notes like this from physicians who see patients in skilled nursing facilities and assisted living facilities where the physician may go in and see the patient once a month, for example. Consultations. A copy of the request for the consultation from the physician must be in the patient's record, along with a report, usually in letter form, from the consultant back to the referring physician with conclusions and recommendations or whatever the case may be. Also, if a patient has taken it upon himself or herself to go ahead and get a quote-unquote second opinion, then that patient should make sure that the consultant or the patient, him or herself, supplies a copy so that the primary physician has a full, complete record of what's going on with this patient. Test results, well, of course, ha ha ha. Okay, so we have imaging, which is often called radiology, but it's really more than radiology because radiology is like x-rays. And it also, of course, will include CT scans and MRIs and sonograms and anything, okay? And then laboratory path results. And these are very important as well. Nowadays, with electronic health records, and interoperability, these are usually electronically fed over and automatically placed into the patient's record. But like I said, they still got to be there and in the right place so you can find them. All right, nurse's notes, the nurse's observations about what's going on with the patient, how the patient is doing, any complaints from the patient that have been expressed to the nurse. That's very important because a lot of times patients will feel more comfortable telling the nurse, but they won't, I don't want to bother the doctor. It's kind of interesting. So that part is very important. And then, of course, if any events have occurred, in the absence of the physician. Now, nurses' notes in a hospital facility, of course, would be much more extensive because nurses spend far more time with the patient in a hospital or a nursing facility, an SNF, skilled nursing facility, than in an outpatient center or physician's office visit, but still. Okay, so now let's talk about software and electronic programs and how technology fits into this whole discussion about health records and data. It's important that you understand that the health information software and technology are far more than just electronic health records. The business record systems, known as the patient management software, and there are also maybe separate claims creation and tracking software, which must, in some format, merge or communicate with the health related records, which would be known as your electronic health records. And I didn't include it here, but remember that electronic health records also will include CPOE, computerized physician order entry systems, as well as CDS, which are clinical decision support systems. So there's a lot more to this than just EHR. And I wanted to bring this to your attention so you can read more about it in your textbook. All right, if you have any questions, please ask. I promise you 5 other people have the same questions. You know that, right? Post it to the discussion board or send your instructor an email.